Alright, this is taking place in an emergency department. We are coming to pick up a patient at an outside hospital with a critical care transport team. For this scenario, you will just see me and not my team members. Everything will be mock simulated. So we'll go ahead and get started. I'm going to walk over here and just pretend I'm walking into the room. Knock knock. Hand hygiene. Hi there, Mr. John Smith. As I walk in the room, I'm checking him out. I'm looking at how he's doing. Hey, are you John Smith? How are you doing? And he's responding, he's John Smith. Can I check your ID on your armband, please? Okay. Alright, you are John Smith. Can you tell me your date of birth? You're 74 years old, so that would say 1/1/1945. He is a 74-year-old white male. So, Mr. Smith, how are you feeling today? You don't feel so good? So I'm listening to him, he's talking to me. He's able to answer in 3-word sentences. You don't feel so good? What's going on today? You're having trouble breathing. So his chief complaint is having trouble breathing. And what else? You're having some chest pain. Okay. So he's sitting up in bed because his mannequin weighs about 130 pounds. We're going to pretend he's sitting all the way up in bed. We can't get him exactly higher up. So he's clean. He's well dressed. Like, he's not expensive, but he's well coordinated, well dressed. His clothes are clean. His speech is clear. His affect is normal. He's not flat, but he's interacting and he's responsive. He'll turn his head. So, no signs and symptoms of abuse or neglect. No bruising. None of that going on. Okay. So I know that from the nurse, told me he's 72 inches tall, so he's about 6 feet, and he's 100 kilos, which is 220 pounds. So first thing we're going to do, Mr. Smith, is I'm going to put you on our monitor. I'm going to put you on our blood pressure cuff and get a set of vitals to see how you're doing. You're actively complaining about a short breath? Okay. So meanwhile, I'm watching his respiratory rate while I'm talking to him. So my hand's right here, and I'm counting as it goes up and down for 15 seconds. Okay. So, all right, let me get you your vitals. Let's get that checked out. Your respiratory rate feels a little fast. It does. Yeah, it's about like 28 a minute. That's a little bit fast. So let's get you on this. Let's see what's going on here. So this is my monitor. It's not turned on because it's not actually connected to the live patient, so it's not going to pick up. But we'll put the blood pressure cuff on. And we're going to hit go. Get the pulse ox. Put it on his finger. So the blood pressure is taking. That's on. Okay, with the heart monitor, since I do work with a transport monitor, critical care transport, and since we're in an emergency department, we're going to have a monitor. Obviously, if we're in a doctor's office, it may not have a cardiac monitor. So we're just going to stick these in here. I don't have actual stickers. Actually, I can put these on like this. This is a SimMan. So, okay. So he is on our monitor. Alright, so blood pressure is taken. And I got the first set of vital signs are reading at 135/78 with a MAP of 92. His heart rate is 82, normal sinus rhythm irregular. He is 89% on room air currently. Like I said, he's breathing 28 times a minute. So, Mr. Smith, I see you're feeling short of breath. Nasopharyngeal, so we're going to do this. I'm going to put him on this. Put you in the oxygen, we'll plug it in. There's oxygen. Alright, and then we're going to get your temperature. We'll use this to makeshift thermometer. Actually. So while that's checking, I notice he's awake, he's alert, he's got a GCS score of 15. I'm already looking at how he's responding. He's oriented. Are you able to tell me where you are? You're in Sampson Regional. That is correct, Mr. Smith. So he's at Sampson Regional. Do you know what town that's in? In Clinton. All right. Can you tell me what day it is? It's Wednesday. Okay. So it is Wednesday. You know who our president is. Okay. So he's able to say it's President Trump. He's aware of that. All right. Temperature is done. He's 98.7. So that's that. So then we're going to move on to his neuro exam, look at his head, things like that. So the first thing I'm going to do is I'm going to say, I've already asked him his orientation, stuff like that. He's responding, can you squeeze, squeeze, squeeze? Good job. Do equal grips. He's going to lift up his hands. He's going to hold them up, and they're equal. We're going to count to 10 seconds. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. And he's doing good there. And then while I'm down here, have him push on my feet. Can you push, push, push? Good job. And he's going to pull back on my feet. Good job. He's going to lift his legs and hold it up for 5 seconds each. 1, 2, 3, 4. Good job. 1, 2, 3. And while I'm doing this, I'm actually feeling his skin as well, kind of integrated into the assessment and see how well he's following commands and directions. And I'm also feeling like for the temperature and noticing there's any edema. And just kind of while I'm talking to him, just stick my hand lightly here and kind of checking out pulses at the same time. So I'm noticing he's got some weak pulses. And his feet are all cool. And I'm noticing he's got some 2+ pitting edema down to the lower extremities. And feeling like, okay. And so we're going to go back up here to neuro. And when I did this, I'm talking to him, say, okay, Mr. Smith, we're going to check your pupils. I'm checking his radial pulses. And while I'm doing that, I'm comparing it to the monitor, discreetly looking. And it's regular and it matches, so we're not missing any beats. So, Mr. Smith, I'm going to check your pupils real quick, okay? Alright. So, I'm going to turn his head towards me. I want you to focus on me. We're going to dim the light, so the lights are dimmed. I'm going to take this light, look at your pupils. Just look straight ahead. Alright, so they're equal and reactive. So equal, reactive, and light accommodating. Okay, so light comes back on, light's back on, we turn off light. And then we tell them, hey, keep your head straight, focus on this pen. And go up and down, and over to the side, and come in. And we're checking to make sure his pupils are tracking. Next we're going to do is have him do his finger to his nose to my finger, and we're going to go back and forth. Now, like I said, he's a mannequin. He's a nice mannequin, but he isn't bent. So we're doing finger to nose, finger, back and forth, and we're checking for ataxia, and we'll do it in both hands. So, finger, nose, finger, finger. And if it's ataxia, it'll be like this, but he is coordinated. So while I'm here, I'm going to continue looking at his head, pay attention to any like bumps, bruises, look at his hair. Is it thinning? Does he have tons of it? Is it scaly? Is it patchy? It's depending on the patient. Sometimes I put on gloves, sometimes I'll just kind of look, and if I need to, I'll put on gloves. So, I put on gloves, put on his hair. I don't feel any bumps or anything like that. So sometimes patients will have bumps that show signs of them falling, hitting their head. They may not remember, especially if they're short of breath with congestive heart failure and they're passing out from being hypoxic. So he's all good. His hair is nice. Average for a 74-year-old male, not super thick and luscious and not completely bald, but it's there. You know, gray in color. So from there, we're going to look at his ears and his nose. So I'll take a peek at his ears, make sure there's nothing in there. And here, and take this off, look at his nose, look at his mouth, see if there's anything in there, look for any edema or any swelling of the tongue, especially if he's on ACE inhibitors or anything like that, they'll get angioedema. While we're doing that, we're going to look at his neck, make sure his trachea is midline, make sure it's not deviated from pleural effusion, pneumothorax, spontaneous, pending, sometimes we do that, it's midline, and then we're going to send him up a little bit, 45-degree angle, and we're going to look for JVD. So he was sitting inside the bed. He wasn't quite tripoding. He was just breathing a little fast, but he wasn't leaning forward. He was just sitting up inside the bed. So he's doing good. So I put him on the oxygen, we'll reassess, and send his sats are up at 93%. And his respiratory rate has come down to 22. So my heart monitor is monitoring the respiratory rate, which is another thing. If I can, I'd put him on end-tidal nasal cannula. That does an inline carbon dioxide detector, expiratory. And I would do that and monitor that as well. And that comes more into play with COPD or how other ventilation, oxygenation, perfusion. So, from there, you know, I've kind of had my hand on his chest this entire time. So, hey, how you feeling? I'll put my hand here and I'll see if there's any pounding sensation to his chest. See if I can feel the right side of the heart. And somebody can feel that with somebody in his heart failure, especially right-sided or a valve that's backed up, so you can feel that, especially infected endocarditis. And I'm looking at his skin color. Is his skin warm, dry, or is it sweaty? Is it moist? And then I may keep going and say, Mr. Smith, what happened today? As I'm talking to him, I'm feeling him, just kind of looking at a rash. So, Mr. Smith, what happened today? So you woke up this morning feeling short of breath, sweaty and anxious, but you don't feel sweaty anymore? Okay. How long have you been feeling short of breath? So you've been noticing it's been going on for about 5 hours? And what else about this? Have you been feeling short of breath when you walk lately? You have noticed you've been feeling short of breath with exertion. Now, is this down to the mailbox or is just across the room? And he's telling me it's just across the room. What about flights of stairs? And he said, yes, I get short of breath going upstairs. He also tells me when he walks and he feels like he's had to require more work of breathing. So I say, okay, and what about this swelling to his lower extremities? And Mr. Smith tells me that, hey, how's your swelling to your lower extremities? How's this swelling going down your legs? And he tells me it's been getting worse recently. Have you ever had this before, Mr. Smith? And he tells me, well, he used to have this a year ago, and that he was on Lasix. So you're on Lasix, and they took him off of the Lasix a year ago. So you were on Lasix a year ago for it, and do you know if you had congestive heart failure at that time? You did not. Okay. What other medical problems do you have? You have stents. So he tells me it's cardiac stents. You have a hypertension, so high blood pressure. Okay. Oh, you're a diabetic. Okay. And you have COPD. Okay. So he's telling me that. He's also telling me that he also had a history of prostate cancer. Okay. Is that still ongoing or are you in remission? You're in remission. So the COPD, did you used to smoke cigarettes? You did. Okay. How do you still smoke? You don't smoke anymore? That's very good. How long ago did you quit smoking? You quit smoking 15 years ago. Excellent. How long did you smoke for? Should be 74, so 64, we'll say 59. So you started smoking at how old? 12, because you were working in the fields. Okay. So I've assessed that. We're also talking about, Mr. Smith, can I go and ask you, have you ever used drugs of any type, including cocaine, marijuana, or any alcohol? Do you drink alcohol? You don't. Do you ever used to drink alcohol? You don't. It's against religion. Okay. What religion are you? You're Southern Baptist? Okay. Are you involved with your church? You are? Okay. So, you enjoy going to church? You do? Are you from here, Mr. Smith? You're from here in Sampson County? What is it you said you used to do? You were a farmer. Okay. Do you still own your farm? You have retired? Okay. Alright, so I'm looking at this. His skin looks good. I'm talking to him. He's got equal chest rise and fall. He's able to answer questions. His breathing's improved with his oxygen. So, Mr. Smith, I'm going to take off my hearing aids just for a second. I'm going to listen to your lungs, your heart, and your stomach all at once. That way, I can keep asking you questions, but I can't hear once my hearing aid's out. So for me, I cluster this because I am hearing impaired, and this is the way I do it. So we're going to take these out, and I'm going to listen to you. So first, we're going to listen to the anterior lungs, which is the front. I'm going to take a deep breath. Inhale, exhale. Another one. Inhale, exhale. And we're going to go in this pattern. Inhale, exhale. And I'm listening for abnormal lung sounds, wheezing. Inhale, exhale. Crackles, which especially crackles, or rails, which would be indication of fluid. Inhale, exhale. So I'm hearing crackles of the bases, and I'm hearing coarse crackles, like they're not soft, they're there. And then we're listening to lateral lung fields, on the other side. And then since he's sitting up, I'm going to listen to the back side. And I'm going to do 1, 2, 3, 4, 5, 6 across the back. And I hear crackles again at the bases. I hear diminished air movement throughout, clear upper here, but diminished and crackles. Now I'm going to listen to his heart sounds. And I should hear a lub-dub. And I'm listening for murmurs, which we describe as S3 or S4. And I hear an S3 murmur with him. And when I'm done, I'll ask him, do you have a history of a murmur? So yeah. Now I'm listening to bowel sounds because I said I'm going to leave them in. So we're going to listen to all 4 quadrants. 15 seconds. 1, 2, 3, 4. And next quadrant. 1, 2. And we're pretending it's 15 seconds. And I'm looking for if they're active, hypo, or hyper. His are normal. Sometimes they'll be hyper if they're hungry, or if they've been having lots of diarrhea. And there might be hypo if he's got an obstruction. Okay, so I'm going to take my hearing aids out. So I'm going to continue talking to him and ask him more about his history and home meds. And while I'm doing that, I'm going to just kind of check out his hands a little bit. And I'm going to look at his fingernails. I'm looking for a clubbing. And I'm going to look for his cap refill. And his brisk. And I don't see any clubbing, so, which is kind of surprising because he's got COPD. So, there. I'm going to ask about his home meds. Do you have any home medicines? Okay, you take a Dronab. Is that for your COPD? So he does albuterol aspirin. He also takes what up? Spiriva. So you take Spiriva And vitamin D3. Have you been diagnosed with osteoporosis? You haven't. Okay, so you're just on vitamin D3. Are you allergic to anything? Penicillin. What happens when you take penicillin? You break out into a rash. Okay, so first cath refill, I'm just asking about his urine output. So I noticed he has a Foley catheter in. And I noticed there's 400 ml of clear urine in his Foley. And say, hey, Mr. Smith, I understand you got Foley. Is this normal or is this why you're here? Is they put it in? They put it in here in the ER. Okay. Do you have trouble urinating? You don't. Do you urinate more during the day or at night? You notice you get at night, urinate? Speaking of at night, how have you been sleeping? Able to lay flat? You're not able to lay flat. Okay. So when you get up at night to go pee, do you feel short of breath when you walk? You do. And you thought, is that normal or why do you wake up in the night? You think it's to go pee, and in fact that you just kind of startled out of your sleep? Okay. Do you ever wake up feeling like you can't catch your breath at night? You do. What do you think that's for? Do you think that's your COPD? Okay. Do you sleep in bed, or do you sleep on pillows, or how do you sleep? You sleep in a recliner. Okay, you've been sleeping in a recliner since, how long have you been in that recliner? Since your wife died. Okay. So you don't know if you can lay flat. You didn't like laying flat here today. Okay. So let's continue talking about what happened this morning. So you woke up, you're feeling short of breath and sweaty and anxious, and you were talking about his increased shortness of breath. So what happened? How did you come to the ER? And he tells me he called 911 because he couldn't breathe, he was having this chest pain. So they came out there and they said he was hypoxic and that his oxygen levels were low. And so they put him on BiPAP. They put you on BiPAP. How did you feel if they put you on that mask? Was it the kind that blew tons of air? How did you feel? You felt better? Okay. And he says he felt better and they took him off of it because his lungs cleared up a bit. They did. So you must have had crackles higher up, because if it's higher up, that means you have more fluid. Okay. So then we're going to go on and talk about that. So I asked the nurse, hey, what else did EMS report? EMS, let's see, he was lethargic, decreased level of consciousness before they put him on BiPAP because he was so hypoxic. So it looks like he's had some improvement. And his cath refill has improved with that. So, and then he says he feels better with that. So I'm going to go on to, so I did the lungs, so we talked about smoking, and so with Connor, and then with your COPD, do you get a cough? Do you have emphysema or bronchitis? You have emphysema. Okay. Now, have you had cough lately? You have had a cough. Are you coughing anything up, like thick mucus or anything like that? No. Or you are coughing some. What are you coughing up? Pink frothy sputum. How often was that? Just the past couple days. Have you coughed any up since you've been off that BiPAP machine? It's been better. That's good, because that's all that fluid that was built up. So we're going to go through, we're going to percuss, and looking for dullness, and tell me if there's any fluid or not. I'm going to do all the lungs. I'm going to do the abdomen. So this is why we listen to the abdomen first instead of doing the last, because it will change the abdomen, and then we're going to palpate everything. So here I can palpate ahead of time, but the abdomen I cannot palpate till after. Does that hurt? No, and I'm looking for any enlargement of the liver, any abdominal swelling, ascites, there's fluid there. He has a little bit of a pouch here, and I'll ask him, is that normal? Is it firm, distended? His is soft. So he doesn't have any abdominal swelling yet, anything like that. I shouldn't say yet, but. So he says it doesn't hurt. And when was your last bowel movement? It was 2 days ago. Was it normal? It was. Do you normally go every 2 days? You do. Why is that? Do you have any constipation issues? You don't? Okay. So we talked about his urine. We talked about his nails and all that. And when he was exhibiting the pedal pushes and arm lift, I assessed his musculoskeletal system. Because he's able to sit up for me and things like that. He's able to lift his legs. But I'm going to ask him if he's had any trouble walking for his musculoskeletal wise, other than shortness of breath. So have you had any trouble walking, Mr. Smith? And he says, no, I just feel short of breath when I'm walking. But I said, you don't have any trouble with your hips or your legs or knees giving out? He says, no, I've been walking fine. I just get very short of breath. So, okay. So then, like I said, his skin, so he didn't have cyanosis, which is the blueness around here when we first got here, but I've been looking at his skin. He doesn't have any cyanosis down the extremities, which is good. So that is a good thing. His skin's actually nice, warm and dry. He's not diaphoretic like he was this morning. So this ER definitely did some interventions. So I'm going to find out what the nurse did. So nurse hey, can you tell me what treatments you've done? I know you've done BiPAP. Okay. So she tells me, oopsie, that she's done some BiPAP, and then she also tells me that he got some morphine for the chest pain, chest discomfort. Some, let me see my little sheet. Here's my record she's given me. Okay, so she got some Lasix, so which makes sense with the urine. Nurse, how much output has he had at Lasix? And she'll tell me 1,300 mLs. So we have 400 in the bag, 1,300 mLs in the that she had. And then I'm asking her how long ago it was and how much it was. And she's saying it was 90 minutes ago, and he got 80 AV. So in 90 minutes, he's had 13, 14, 15, 1,700 mLs of urine out, which is good. So Lasix is working with him, so his kidneys look somewhat decent. I'm going to also ask her, so he got a heparin bolus, and they started on a heparin drip, which I noticed because they tell me that he has some elevated cardiac enzymes, which we will go over. And this tells me that he also got nitroglycerin drip, and come to find out his blood pressure is high. When he first came in, apparently he was like 205 over 1 at 110. So they started a nitroglycerin drip because he's also complaining of chest discomfort. So I'll say, hey, Mr. Smith, how's your chest discomfort feeling right now? And he's going to tell me it's a 2. And I say, where is it? And he's going to tell me it's here, it's pressure, it doesn't radiate, it's just there. And I'm going to ask him, so how long has it been feeling like that, and how did it feel this morning? And he's going to say, this morning it was spreading, it was more intense, it was 8 out of 10. And so I said, okay, so the nitros worked. So we currently have him on 30 mics of nitro, so we can bump him up 40, see if we can get him pain-free. That is our goal. CHF will sometimes exhibit chest pain, just ventricles aren't working. So we'll go over that and we'll say, so you got some labs done. So it looks like while you're here in the ER, you had a BMP, which is a brain natriuretic peptide, which is specific for congestive heart failure, and yours is elevated 891. And then his troponin was done, which is cardiac enzyme, which is released when there's damage to the heart muscle. It was 6.95. So because of that, they are diagnosing him as an NSTEMI versus congestive heart failure, and the NSTEMI is non-ST elevated MI. And so I'm going to discuss all that with him. His other labs, his sodium is 136, which is normal, potassium 3.7, which is normal. His BUN is high, is at 30, and his creatinine bumped up at 1.7, so we got some renal insufficiency going on there. His sugar is 200, and we also look at his liver enzymes. They're decent and we're horrible. His white count was a little bit up at 12.6, and now they think there's an infectious process. His ABGs they did, so his pH is 7.31, so this is arterial blood gas, and this would make sense because he's probably in respiratory acidosis because of difficulty breathing. So he's acidotic, and his PCO2 is 39, which is actually really decent for somebody with COPD, and his PO2 is 276, but I think that's because they probably had him on BiPAP, a lot of excess oxygen. But the concerning thing was his lactic acid was 5.8, so that means there's some lactic buildup in the tissues. And they did a chest x-ray, which shows some pulmonary vascular congestion that was indicative of congestive heart failure. So Mr. Smith, let's get you in my truck, and we'll talk about what we're going to do in Raleigh. So we're going to keep on this monitor. I'm going to tell you what the game plan is when we get to Raleigh, okay? We're going to talk about some more stuff. So we're loading him in the truck. We're in the truck. So we're going to talk about, his lifestyle, what kind of diet he follows, social stuff, and more. So, Mr. Smith, we're going to go ahead and do an EKG. I'm sure they already did one in the emergency room, but we're going to do another EKG. When you get to Raleigh, they are going to do some more labs, and they're going to repeat that BMP, and they're also going to look at your cardiac enzymes again. Those two things they specifically do with your heart, and they're going to monitor your BUN and creatinine, which monitors your kidney function. Because sometimes if your kidneys aren't working, the fluid can't get out of your body, so it backs up in your heart. So we're going to see which one's causing what. You definitely have some fluid overload going on. We just need to find out why. So with that, we're also going to look at cardiac cath, your meds. They may look at your meds now, do a beta blocker or a ACE inhibitor or things like that. We'll talk to your cardiologist. So you told me that you don't smoke, you don't do drugs. Do you exercise? You're a retired farmer. Okay. So you're a retired farmer. All right. Well, do you go walking? You walk out on your farm? Okay. Strenuous or just casual little walks? You go walking with your dog. You know what? It's exercise. How often do you walk? You walk about a mile or two a day? Okay. You just do like a nice leisurely stroll to get your heart rate up? Okay. Well, that's good. So we talked about how you quit smoking. Okay. How's your diet? Do you watch your sodium? I saw you have hypertension, high blood pressure. Do you watch your sodium? How much salt you do? You do? Well, I know you're from the South, and we like our fat back and butter and everything in our green beans, and we like our fried chicken. Your wife makes you eat baked chicken. Okay, well, that's good. It's a good start. So you're not doing any added salt. Well, good for you. And you're not doing any of that lard and fat back in your food. You don't. What about your diabetes diet? Are you following low carbs? You are. And you take your meds for your diabetes? You do a pill or an insulin injection? You do a pill? Why? They didn't say that was on your list. Okay. Oh, you said you've been having success with the diet control of diabetes. Okay. Well, that's very good. So, Mr. Smith, do you have any issues obtaining your medications due to finances at all? You don't? What about getting food? Do you have access to healthy foods? I know you're a farmer, but you said you're retired, so you're still growing your own, you have your own garden. Okay, what about meats and things like that? You have access, able to afford it? You do? Okay. All right, that's very good. I'm glad you do. And then you said you sing in the choir at your church. And you're Baptist? So, do you go every Sunday? You go every Wednesday and Sunday. Okay, are you very involved with them? You are? So you lead their youth group and things like that? And the men's group? You do? Okay. Well, that's good. And you also hold clothing drives for the citizens of Sampson County? Well, good for you. That is awesome. So do you feel like you've got a good connection? How's your wife? I know she's not in here, so you can talk freely. Your wife, you've been married for how long? You've been married for how long? 60 years. 60 years, 74? 14? Oh, 50 years. I'm sorry, 50. 50 years. That's a long time. Congratulations. So you've been married the same one 50 years. That is awesome. Is she also from here? She is. Do you have any kids? You have 3 children? Do you have any grandchildren yet? You got 2, and you got 1 on the way. So 2 grandchildren, 1 on the way? Good job. Are y'all really close? Oh, so your children took over the farm. Okay, so they're all here in Sampson County. All right, well, that's great. I'm glad. So, we talked about that. We talked about diet. We talked about the low sodium. We explained to him, when he gets out of the hospital, they're probably putting a plan on cardiac rehab, and they'll talk about low, flushing his fluid intake, and then we'll do his cardiac cath and his echo, and find out what is the source of congestive heart failure, how bad it is, what stage it's at, and he'll get a complete workup. For right now, our goal is to maintain where he's at, decrease symptoms, get him comfortable, and then they will investigate and find out what's going on and set up a long-term plan. So, thank you, Mr. Smith. All right, thanks. Have a good day. Ooh, how do I turn it off?